Hey, this is Dr. Ivan. I wanted to give another 15-minute stretch routine. We're going to go just a little bit deeper on this one, so let's get started. Let's take a deep breath. And exhale as you go to the side. Again. Remember to use your diaphragm. Let that belly come out. And then drive it back in. You can do a moderate stance. You can do a wide stance. Let's take our arms wide. And forward fold. Put your hands over here to protect your lower back. Come up a little bit. Arch that back and push the buttocks forward. And then exhale and forward fold. Come up. Support yourself if needed. And then forward fold. Let's go ahead and turn to the side and perhaps allow yourself, maybe with a little bit of assistance, to hold your knee, position your knee right over your ankle, and allow that rear leg to slowly slide back. And supporting yourself, you could also use like a yoga block or something, a book of some sort or whatever to support yourself if needed, and try to allow your pelvis to come down while you keep that knee straight and let the pelvis come down. You'll feel this in your hip. If you have osteoarthritis in your hip, just do it nice and gentle. Of course, remember, don't force anything. This is just about a 15-minute routine to get you started. Now you can come up and just switch to the other side. Take your time going over to the other side. You've got your feet in about the right position. Come up. Deep breath. And again, nice and easy. Allow that pelvis to come down. If you can, try to keep your belly button pointing down. If you have to twist, that's okay too. You're here, and I'm happy that you're here. Now, you've got a nice wide stance. See if you can keep that. Whether you have yoga blocks or what have you, those will help you if you need to for some added stability. And as you begin trying to become more flexible, use whatever's necessary to assist. Take a deep breath in and come down. Again. And down. I'm trying to get these inner thigh muscles, the groin muscles, to get a nice, easy stretch. Let's go ahead and bend those knees, point your feet out a little bit, use your hands if necessary to support you as you come into this position. You should feel that you're engaging your core. Might feel a little unsteady, that's okay if you need a wall or what have you, but see if you can take a deep breath in. And as you exhale, come down just a little bit farther and stretch that pelvis. Come up and down. This is very important. As we age, we forget that our brain continues to find the easiest path of motion, as opposed to children running and jumping and doing everything. As we age, we begin to lose our mental connection to these muscles that we barely use. And so it's very important that we begin to regain connection with our pelvis. Pelvic floor weakness is a very important part of balance. When our pelvic floor becomes weak, we lose our balance. With balance, you can preempt yourself for a fall if you're not taking care of yourself. Okay, let's bring our feet, creep them forward, And let's turn to the side or stay in that position. I'm just trying to make it easy for folks. So let's go ahead and do a forward fold. Arch your back as you come up, halfway up, and forward fold. Again, and forward fold. I'm going to walk my hands forward and go into a downward dog. Remember, try to keep your fingers engaged. We really want to keep all those muscles of the hand really engaged and open up so that you get a nice, firm, stable platform from which to support yourself. As you can see, I'm doing one leg right now because I want to further stretch that plantar fascia, the Achilles tendon, the calf muscles, and the back of the knee all the way up to the sits bones, the ischial tuberosity, which is part of the pelvis, and you can feel that pull all the way there as you slowly, never forcing it, but slowly try to get that heel down. Once you do one, do the other. And if you have to stop because of a cramp or a tightness, you do what you need to do. Nice and easy, remember. Just the fact that you're here makes me happy. Don't worry about what it looks like. Just connect with your body. And feel that stretch coming all the way up. This is very, very good to stretch out the lower legs, to help reduce the cramping that occurs at night. If you can, let's go into a forward plank. And then into an upward dog. Allow that pelvis to really fold forward underneath you. Pinch your shoulder blades together so you engage the shoulders, you engage the mid-back muscles that are so important. We're constantly sitting, we're working at a computer, we're working at our desk, and our shoulders will naturally slump forward. We need to engage the muscles of the mid-back to retract those scapula, to retract the shoulder blades so that we can create some stability back there. In a forward position like this, you can get into your tabletop position, and we can do a bird dog stretch, and you can exhale. Try to maintain your balance. Let's do the other, and you can continue with these. I'm doing a shortened version here. This is only going to be about 15 minutes, but you can go ahead and make it as long as you want. Once you've seen us do this a couple of times, create your own routine. Just do it. Now, a motion that I'd like to see if we can do is to go ahead and come down into this position with that leg extended, and try, if you have to bend the knee, that's totally okay. But if not, try to open up to the side and rotate your head up to the sky. Nice and slow. Stretch if you get a little cramp, and just do it again. Now, you can turn to the other side or switch. And again, great stretch. You're going to feel this all through the hips, through the back of the leg, through the front of the leg, in the knee. You'll feel it in the lower abs. You'll feel it in the lower back. You'll feel it in the hamstring. It's a wonderful stretch to just increase the connection that you have with your lower body, mid-body, shoulders. And if you can, get a nice, use the yoga blocks again if necessary, but just get a nice stretch of that groin, but move everything nice and slow. It's so important for you to be able to do so. I'm just breathing to help regain more of a connection with your body. The side motion. When you start out in the beginning, it'll be difficult. But as you continue through the routine, you'll notice that this will get a little bit easier. It'll make it easier for you to take a nice deep breath and slowly fold forward. And see how far you can go down nice and easy. Again, use your lower legs when needed because it's so important for you to protect your lower back and all the muscles of the spine. And you can come up halfway and breathe out. Now, if you can, get back on all fours, and if you need to, fold your yoga mat or a pillow or a rolled up towel underneath your knees if they bother you. And let's see if you can allow your knees to open up and come into a child's pose, where you lower your elbows down and bring your pelvis back. Now, we're putting our pelvis and our lumbar spine into a forward flexion position. However, there's no weight. And so you're actually helping protect that lower spine. You can bring your feet up like this if you cannot reach all the way back, but just try to forward fold. Allow your head to rest forward. Take a deep breath. And let your pelvis sink backwards. So we've done that position now from the front, and we're going to now roll over onto our back and finish off with knees to chest. Oh, you can also, if you have the ability, turn your hands the opposite way, and let's do a reverse tabletop. If possible, if not, that's okay. And even if you can only come up a little ways, that's fine. But if you can, stretch all the way back. Be mindful of your shoulders so that you protect them and you don't overstretch them. That's a motion that you can do for a few breaths. If you want a little bit more, you can. And let's go ahead and bring our bodies back to the mat. Take a deep breath and then bring your knees all the way up as far as you can. You can grab the back of your legs if you have to, but let's take a deep breath first and let that diaphragm come out. And then exhale. Yes, you can bring your body up if you want an added contraction of the abdominal region. You can flex even farther. And you might hear some segments pop like they just did in my spine, which is totally fine. Normally it's never associated with any pain. It's just segments that are going into motion. And nice easy breath. If you have an extra few minutes, you may go ahead and relax. Allow your arms to rotate out. Let your feet just relax. Let your pelvis relax. Take a couple of deep breaths. And it's a great way to start your day. I think it's a great way to end your day. And it's something I like to practice each and every day, to just take care of the one body we have that came from above and came from within. It's our responsibility to really take care of this body and to give it love and to give it respect so that it works for us and our families. Every time you move, just do everything deliberate, with caution and connection. I hope this helps. See you next time.